Next up, we have Dr. Ben Carson. He's the former HUD Secretary, author of many, many best-selling books, a neurosurgeon, founder of the American Cornerstone Institute, and one of the most prominent Black conservatives in the country. Thanks so much for coming on again.
Thanks, Tony. Thank you, everyone, for the comments that have been made. You know, showing a united front is going to be a tremendous help to the MAHA movement, having many people coming from many different perspectives, all saying the same thing. You know, health is so vitally important, and most people don't really think about it until they don't have it. And working proactively to make sure that we do have it and that we continue the human flourishing is so important, and the policies need to be consistent with that. You know, just the fact that we have a lot of consumers who are looking at what's going on right now, looking at the fact that we're putting artificial sweeteners, artificial coloring, artificial flavor, artificial this, that, and the other in our foods. It's really one of the obvious differences between us and a lot of other nations, particularly a lot of other European industrialized nations who have much the same environment as we do, but their life expectancy is continuing to go up while ours is going down. And that would certainly point one toward some of the things that we are putting in the food. You know, for several years, we've had to put up also with a lot of lies and obfuscations that really have disrupted the public trust. And of course, I think of COVID. You know, here we have a situation where Dr. Fauci et al. Said, don't need to wear a mask. Then, well, you do need to wear a mask. Maybe you need to wear two masks or a mask made out, but eventually admitting that there was no science behind any of what he was saying, and telling people that, you know, if you get the shot, you can't transmit the disease. There are no real side effects, where, of course, we know that the side effects from COVID vaccinations far exceeded anything else in the last 30 years combined. We haven't been truthful about that. It's important for us to lend our voices to that and not to just let it be swept under the rug, as is the case in so many cases. And then I think we need to educate people. When we talk about we don't need this kind of fat or this kind of fat is good, most people have no idea what we're talking about. We need to be educating people in addition to protesting what's going on. I think that's a big part of what MAHA is going to be doing. You know, I, as a neurosurgeon, you know, was mostly concentrating on surgical technique and statistics. But when you stop and think about it, it doesn't matter which area of medicine you're dealing with, it is affected by the condition of the patient. And we need to really spend a lot more time thinking about the condition of the patient. How do we get people into good condition? It's not only food, it's also exercise. It's also remaining hydrated, which is not talked about nearly enough. Particularly the brain needs a lot of water. We don't talk about sleep, which is a critical part of a person's health. And just lifestyle in general, what a difference it makes. And I think we need to really make sure that we integrate that into the things that we're talking about. Transparency, accountability, all the things that are being ignored or have been ignored until now. I think it will make a huge difference when we are the ones collectively who talk about this. And President Trump is very much into this ideal of the MAHA movement, is very supportive. Agriculture Department as well as HHS working together with the FDA. You know, we've never had that before. and the relationships are very cordial. So all of you are a part of that, and I thank you.
Thanks so much, Dr. Carson. I mean, it's a great point that this is an incredible chance that we have to roll back 20 or 30 years of corruption, of food, drugs, medicine, pesticides that have been delivery mechanisms for toxins.